Hi to all of you. Today we are going to deal about one important topic in general medicine, which is diabetes mellitus. So today I'll be talking to you about classification of diabetes mellitus, the genetic background and influence of the environment on diabetes. So first, what is diabetes? Diabetes is a disorder of metabolism of the fuel in our body. So there are multiple steps in the pathogenesis of diabetes, multiple ways in which our body is deranged for us to develop diabetes mellitus. So our body is not able to properly process food taken by us, and it is not able to produce a sufficient amount of insulin, or either we are producing a sufficient amount of insulin, but this insulin is not able to exert its effects properly. So that is when diabetes comes into play. As you all traditionally would have been taught, diabetes is type 1, type 2, but all those classifications are not used much now. We will go on to the classification of diabetes mellitus. So this is the ADA, American Diabetes Association classification of diabetes mellitus, and as you can see, there are predominantly 4 types: type 1, type 2, type 3 and type 4 diabetes mellitus. Type 4 is a special scenario in case of antenatal patients or gestational diabetes. We call it as type 4 diabetes mellitus. So type 1, we have type 1A and type 1B. Type 1A is immune mediated or idiopathic. This type 1 diabetes is what we previously used to call as the insulin dependent diabetes mellitus. That is, in people who ever had a deficiency of insulin, we used to label them as type 1 diabetes mellitus. So the etiology we used to tell it is autoimmune. So whatever is immune mediated causing type 1 diabetes mellitus is now called as type 1A diabetes mellitus. In some people, we are not able to elicit or by tests, we are not able to prove these immune mechanisms which are causing destruction of the beta cells which produce your insulin. So such people are labeled as idiopathic type 1 diabetes mellitus, but they also have a deficiency of insulin. So that is called as idiopathic type 1 diabetes mellitus. And next is the type 2 diabetes mellitus. This is what we used to call as non-insulin dependent diabetes mellitus. That is, it was assumed that these people have sufficient amounts of insulin, though they have sufficient amounts of insulin, this insulin was not properly used by the body, or the insulin was not able to exert its action properly. Though insulin is available, a body is not responding to the insulin properly. That is called as type 2 diabetes mellitus. Type 3 diabetes mellitus includes multiple subtypes which we will be seeing in the next slide. Type 4, as I already told you, is gestational diabetes mellitus. So type 3, there are multiple types starting from type 3A to type 3I. So it includes type A is called as MODY. MODY is an older terminology. Now we have replaced it actually. So we will see about MODY or MODY in detail in the next slide. So type 3A is a defect. It is a genetic defect. So genetic defect in certain glucose processing molecules. It is called as either MODY, or there can be a defect in the mitochondrial DNA or genetic defects in insulin action. All these come under type 3A diabetes mellitus. Type 3B is transient neonatal diabetes. As the name itself suggests, it is a transient phenomenon and presents in neonates. Type C is exocrine diabetes mellitus. All of us know that the production of insulin happens in the pancreas. Your pancreas is composed of exocrine part and endocrine part. Exocrine part produces all the secretions of your pancreatic juice. Endocrine pancreas is consisting of alpha cells, beta cells and your delta cells. So your beta cells are going to produce your insulin. So this is called as endocrine diabetes. Whenever you have a disturbance in the beta cells of the pancreas, which are concentrated in groups called as islets of Langerhans, that is called as endocrine diabetes. But you have a disturbance or some disease affecting this part of the pancreas, say pancreatitis. There is complete destruction of the pancreas due to inflammation. Then inevitably your endocrine part of the pancreas also is going to get destroyed in such a situation. So exocrine diseases of the pancreas will cause destruction of your beta cells leading to insulin deficiency. That is type 3C. Then you have type D, 3D, which is due to type A insulin resistance or leprochaunism or Rabson-Mendenhall syndrome or lipoatrophic diabetes or certain other types of genetic defects. Type E is an endocrine defect. So defect in the endocrine part of the pancreas is classified as type 3E. Type F is drug-induced, 3F is drug-induced diabetes mellitus. Drugs which can cause this are pentamidine, thyroxine, beta agonists, steroids, atypical antipsychotics, thiazides, alpha interferon, nicotinic acid and diazoxide. You would have learnt in pharmacology that thyroxine, beta agonists, though we are using it for say hypothyroidism or for hypertension, these also have an effect in your diabetes mellitus. In a normal person also, they cause some mild dysregulation in how your insulin acts in the body, but this, being a normal person, we are able to compensate it. In diabetic people, this effect might be exaggerated, and when at sometimes these effects are getting exaggerated so much so that they are manifesting as diabetes mellitus. So important drugs to remember are thyroxine, beta agonist, steroids, atypical antipsychotics. A psychiatric disease patient coming to you with diabetes, you should always get a history of what antipsychotics they have been taking. Nicotinic acid. Nicotinic acid is used in the treatment of hypercholesterolemia. The unfavorable effect being its effect on the glucose metabolism. So that is why we don't use it very often. So nicotinic acid also causes disturbance in glucose metabolism. Type 3G is due to infections. Cytomegalovirus, congenital rubella syndrome and Coxsackie virus induced destruction of the pancreas or due to some autoimmune mechanisms. These infections are going to cause diabetes, that is type 3G. 3G is infection. Type 3H is called as Stiffman syndrome. Type I is certain other genetic syndromes. What you can remember is type 3C or exocrine pancreas. Type A, importantly remember about MODY. Type 3E, E for endocrine. Type 3F, drugs. Importantly thyroxine, beta agonist, steroids, nicotinic acid and your atypical antipsychotics. Thiazides are another important class of drug. Routinely we are using thiazides for patients with heart failure, or we are using them in treating heart failure or in people with volume overload. So such people are prone to develop disturbances in glucose metabolism. Type 3G is infection. All your viral infections, cytomegalovirus, congenital rubella and Coxsackie virus. These are the important things you should remember in this. Know that there are 4 types of diabetes mellitus. 4 is gestational. Type 1 is immune mediated or idiopathic. Type 2 is mainly due to insulin resistance. Type 3 is classified into multiple subtypes. MODY comes under type 3.